This is Alberto Rullan with Performance Equine Veterinary Services. I have the pleasure to be sitting across Brandon Ames from Anicel, which is a pioneer on the Amnion therapy. Now, Anicel works with Amnion. Amnion is a real novelty product that is coming into the use of horses and dogs and people for many issues. So thank you very much for being here with us, Brandon. And please introduce yourself to our audience. Tell us a little bit about you, how you got into this amazing product, an amazing endeavor.
Thanks, Alberto. It's great to be here. Anicel, we started Anicel and kind of pioneered Amnion technology in 2015. Got into it. It was kind of by fluke. I don't come from the biology space, but in 2009, my mother and daughter lost two horses due to a lethal interaction of corticosteroids that chemically foundered them and dropped them through their feet. Fast forward about 5 years, this technology was presented to me by some folks who had pioneered it on the human side. Wanted us to take a look at it to bring it into the animal space, and I needed a new startup like I needed a hole in the head, but good Lord decided to thump on me a little bit. And after I kind of turned down the opportunity three times, it was one of those things, no, Mr. Ames, you're going to do this. So we brought it to market in 2015. Dr. Rullan, we're in the recycling business. We're just recycling what God made all living things from and using that material in which to treat tissue-based injuries.
So, Brandon, thank you very much. I'm going to keep notes while we do this because you have so much information. And even though you told me 1,000 times, I keep forgetting sometimes. Um, can you tell me the most common question I get? All right, what is amnion? This is something that when I was in vet school, I never learned about this in vet school, and our listeners and our clients really ask me that question: what is it? What's in it?
Yeah, so it's a great question, and we get that question a lot as well, Alberto. The thing that really comes to us is how can it be regenerative and how does it work? And amnion is that innermost membrane and fluid that we say is fetal facing in the womb during pregnancy, and so that material, and we know this based off of a 2015 Stanford study, that material is brought into the body and into the lungs. And the body, they found from that study that fetuses don't just grow from the inside out, they actually grow from the outside in, processing that material. And so when we've characterized it, and we did that in 2017 at North Carolina State University. When we characterized this material, looked at it to see what was in it and find out, we found all the basic building blocks of tissue growth. So the three main things you've got to have in which to grow tissue: you got to have cells, you got to have the basic building blocks of extracellular matrix, which is kind of the material around the cells that connect them together, and then you have to have growth factors signaling things that say do this and do this, and we always kind of use it from an analogy of a tornado going through a Midwestern town and knocking over a brick building. Yeah, it's kind of an oversimplification, but if you think of the bricks as the cells, the mortar as the extracellular matrix, and the specialty contractors as the growth factors, when that tornado rolls through, the first thing that happens is people come out and they turn off their water and they turn off their electricity, and we call that hemostasis in the biology world. The first thing that's got to happen, you got to stop the blood flow when there's an injury. The second thing that happens is inflammation happens, and that's the same thing. It's truly a cellular phone call that people make. Hey, I can't fix my broken house here. Can you send somebody? And so they call FEMA and they call their insurance adjusters, and nobody answers the phone call. Nobody comes to help them. And so that inflammation persists. That cellular phone call keeps getting made. And what we do is we airdrop in all the basic building blocks of amniotic tissue in which to rebuild that.
That is an amazing analogy, and I cannot come up with anything better. That is amazing. Please replay this of what he just said because that is an amazing analogy. You can pause it, replay it until we memorize it. 'Cause that's excellent. Thank you so much for that analogy.
You're welcome.
Um, so let's go back a little bit on the process, okay, of Amnion because what's the latest thing going on in human in human medicine? Because I always say human medicine is kind of behind horse medicine. I was using stem cells and PRP way before they were using it in human.
Right.
So let's go back a little bit on the collection because people understand a lot about PRP, a lot about stem cells, etc. So let's go back even further to how you collect it and are there stem cells in the product? You already say so that there were cells, so I want to go elaborate a little bit more what kind of cells they are. You talk about building blocks, so without us getting into a deep science, let's talk a little bit about the kind of cells and briefly going over the growth factors, but how do you capture this? So let's tell us how, because I think it's fascinating how you prepare the horse, how a client sends you the horse and you prepare the whole thing, the whole well coordinated orchestra that you have to get the final product. I want you to tell us
Yeah,
everything.
it's a great question, and it's of a big concern to a lot of people. Are you raising these pregnant mares in which to take this product from them? And we don't own at Anacel. We don't own any mares of our own. People want to be a part of the Miracle Ranch program, and so they bring us their mares, and they volunteer to bring us their mares so that we can foal them out. We have a special facility, and it's not overly special. It's a barn and some pastures, and but we treat it like a blood plasma facility, so that there's never a chance of a communicable disease or uh, any type of pathogens in the soil. So we do $2,500 in testing on these mares prior to them showing up, which it's a lot of tests.
Awesome.
There's a battery of over 50 tests that are run on these mares to make sure they're clean, and it's simple blood tests, but the extensity of the uh, what is run on these mares is pretty substantial between fecal samples and urine and nose swabs and such. And so once we get those results back and clear the mares, then people bring them to our ranch a month before they're to birth out, and at that point we go through and they show up at the at the Anacel maternity spa, and so we have a whole host of volunteers and folks that oversee their care, love on them, bathe them, and then they get grass during the day and blanketed at night if it's cool out, and so they get a lot of loving and then we sit on a 5 gallon bucket like Johnny Bench, the baseball player, and wait for mares to full out. And we catch them as they come out, and then we send mother and mare or mother and foal home, and we rush the material off to the lab, so we retain all of the custody to it. It's not like we're going to some repro facility and here give us your. We no, we want to own custody of that all the ways through and make sure that we've fully got the understanding of what transpired there, in addition to all the testing we do in which to ensure its safety.
Fascinating. So now you have the mares giving birth, and just out of curiosity, what do you do? She's giving birth. You say you're catching them, and does it take any? Can the baby just be in the ground and then get it from the ground? How does that system work?
Yeah, so we there's it's a 3 person collection. The foal is and mother's care is priority. If it looks like everything's going to be normal, then as that mare goes to have her baby, we would drape the area
Oh,
in
you
which,
drape
oh
the
yeah,
area
so we drape the
like a
area.
surgical suite.
Yeah, we're all gowned up. I mean, it looks, I mean, it's as clean as you can make it in a barn. All
Ah,
right. And to keep it as normal as you can keep it. And so once they present and we're in that process, then we lay down some drapes, capture the material, and it never even hits the drapes. We're able to keep it up off the ground and capture the fluid. And once that's done, then it's rushed off to the lab, and they take it from there.
that's amazing. That's quite a production right there.
It is a
Very,
production.
very nice. So now we have the cells. Well, now we know where we get the cells. We get the amnion. We separate it from the placenta, etc. Right? And you take it to the laboratory. The laboratory does the magic,
Yep.
and then after that, you have this amazing product that comes in a vial or in many different forms. Can you tell us all the different permutations that you can get? I know that you do a vial with fluid, you get a vial without cells, you have a membrane. Tell us all the products that can come out of that.
Yeah. So we talked earlier that amnion contains all the basic building blocks of tissue growth, and so it contains some root stem cells, both mesenchymal and epithelial stem cells. The one cellular component that it does not, stem cell component that it doesn't contain, is it doesn't contain hemopoietic stem cells. And hemopoietic stem cells are blood-based stem cells that carry with them what we would call as antigens that would stimulate, and this is getting pretty technical, but a major histological
Let's keep it
complex.
simple.
Yeah.
I don't know what that means.
So we're never going to get any rejection with these types of products, and
Excellent.
that's ultimately what I'm alluding to here, is because this product is what we term as immune privileged. We're never going to have those rejection type issues, and
So that's why, sorry to interrupt you, but that's why we can use from any mare on any patient.
we can use it both what we call xenogenetically, to
Which
where
means,
we're going from one animal species to a completely different animal species.
wow.
And that, if you think about it, I mean, the amnion's in everything. You take a hard-boiled egg, that little inner membrane of that hard-boiled egg, that's amnion. And so it doesn't matter whether it's a reptile or a fish or a human, they all have an amnion chorion membrane. That chorion membrane being the outer membrane that goes around the amnion. They have that technology to wall off this fetus from the mother's immune system. And so it's natural in all living species, and so it stands to reason that we would be able to use it cross species as well.
That is amazing.
Yeah.
That's absolutely amazing. So let's get a little bit into. Sounds like this technology will work fantastic to heal many things, and now many animals as well. So let's go a little bit. Most of our easy and difficult cases. I have a lot of tendon cases and ligament cases in our rehabilitation center at Epic. How do we use that?
So when we're talking tendons and ligaments, basic tendonitis type issues, core lesions, we use this product in an implantable format, because we're not just injecting a drug in there. This is not a drug. This is a regenerative product. It's tissue from one animal that we're implanting into another animal. And so with that implantation, we just place it close to the indicated area where the wound is, and the body takes it from there. So if we go back to our analogy a little bit, Dr. Rullan, uh, we wouldn't take our semi load of material that we airdropped in to rebuild that house and stick it right in the middle of the slab and build around it. We'd take that material and we'd actually set it off to the side, and then you'd break it down and bring it in as some of your bricks, and then you'd make some mortar and break that down, and then once you got on the inside, you'd pull in your plaster board and all of your electrical material and such. And so we break it down as we need it. And the four things that happen when we inject a tendon or a ligament injury, the first thing that happens is the body instantly recognizes that material and goes to breaking it down as a bioscaffold. And so if you look at any of the pictures of our wounds, you'll see a yellow tinge to those wounds. And in that yellow tinge, that's the amnion breaking down and becoming tissue. The second thing it does is it upregulates both progenitor cells and the immune system to that location. So it's gonna bring in circulating stem cells. The third thing it does is it promotes neovascularization at 5 times the rate. The body will do it on its own. And the fourth and final thing is that it'll manage the inflammation in that space.
So vascularization means new blood vessels, just to make sure
Exactly.
we don't give our listeners many misunderstanding words. So excellent. All right. So then you talk a little bit about wound. So we went from tendons to wounds. So we're using this on wounds as well. How are we using it on wounds?
In wounds, it's a one and done treatment for wounds, and so the existing standard of care, we slather something, we clean it, we debride it, we slather something over the top of it, and then we change that bandage every day, sometimes morning and night, and every time we slather some more stuff on it and continue with with Anacell stem wrap product. Basically, we're treating that one time with a bio bandage that is nothing more than unadulterated amnion that is preserved in a special way and cleaned and sterilized so that veterinarians can treat one time at the beginning, lay that tissue on top of the wound, stick a non-stick telf over the top of it, wrap it up, and then we change the bandage every 10 days thereafter. We don't change it every day, and we only treat one time.
That sounds like a significant decrease in labor, huh?
Significant decrease in labor. Oftentimes, I have veterinarians who come to me and they say, "Well, Brandon, this is more expensive than what we're doing." And I'm like, "Yeah, you're kind of looking at it wrong. How much time is your owner spending changing that bandage every day? What risk are we putting that owner in? Because unlike when you go out, Dr. Rullan, you sedate the horse. They don't have that luxury. And so we may be introducing undue risk. But anytime we've taken a wound that would normally take 60 days to heal with an existing standard of care, we typically heal those in 30 days with significantly less bandaging and no day-to-day care that we would normally experience.
Wow. Um, just out of curiosity, because some of us who have seen a lot of wounds, keeping a bandage for 10 days in an open wound is a little scary. How does it look like at the end? How do we go about this? Because I cannot put it on my head yet. How am I going to do this?
Yeah, so when we initially uh, apply that material to that wound, we lay that on there after it's cleaned and debrided, wrap it up. And the neat part about amnion is because it's there to protect the fetus, it has unbelievable antimicrobial capabilities to it. And so the normally we'd want to check that wound, see if we got an infection or anything. In 5,000 cases of superficial wounds, we've never seen an infection once we've unwrapped that wound because the amnion's antimicrobial capabilities retards any of those infections. It's that upregulating of the immune system to the location that allows us to wrap it up for 10 days and not worry about it.
Excellent. Excellent. So we have touched on tendons and ligaments. We have touched on wounds. Let's touch a little bit on the most common, one of the common questions I get. How does it work in joints? Let's talk about joints a little bit.
Love that. So we've been treating joints since 2015 and using it very differently than existing joint injections on the market today, whether they be regenerative or whether they be pharmaceutical based injections. With those injections, today we go into the joint and we compromise the joint space in which to deliver whatever it is we're delivering. In 2015, when they were doing studies into Amnion, what they found was there was no efficacy difference, and this was in two different studies that was started in 2014. No efficacy difference between interarticular or periarticular injections.
Mm.
Intraarticular meaning in the joint, periarticular meaning outside the joint or around the joint. And so that really affected us in what we were going to bring to market because we were of the mindset, just like everybody else, we had to deposit this material in the joint. And when we found that there was no efficacy difference between interarticular or periarticular, we decided let's create a product that we don't have to compromise the joint space because as you know, Dr. Rullan, you're not in a sterile facility when you're doing these joint injections. You're in a barn somewhere, you're in a less than advantageous space, and joint infections are a huge liability when it comes to causing that horse immense amounts of pain and maybe euthanasia as a result, trying to clear up that infection in that joint. And so if we could create a product that we could treat these joints once a year for performance osteoarthritis, we thought that was the best way to go. And we've done about 15,000 treatments of treating joints. When we started, there was a particular trainer in the Northwest that started using our products on 32 head of horses. This last summer, 7 years later, we pulled X-rays on those same horses and found no degradation in the joint over 7 years with an annual application of our product. And so what we see with the joints is that we're improving the health of the tissue, which is reducing the inflammation. And in doing that, that's what's causing the pain to go away and allowing the animal to perform at its best.
So let me see if I understood correctly. You are using these products also prophylactically, meaning
Correct.
to prevent disease.
Correct.
Excellent. And I'm assuming it's because that trainer usually knows where those horses, between the trainer and the vet, they know where they were going to be predisposed to develop
Well, yeah,
injury
I
based on
mean,
history.
through just like when you show up at a farm to look at horses, you're going to go through and do a lameness evaluation on them and look at their flexion and hocks and stifles and fetlocks and knees and really see where there may be deficits, or you're working with a really good trainer who can say, hey, yeah, this one I'm feeling it and it stifles, or I'm feeling its extension laxing on when we go to a right diagonal or to a left diagonal.
It's a very interesting concept, and I don't want to keep you here for 3 hours, but the fascinating thing is that what you touch in this prophylactically and the trainer feel is that I have learned how to listen to the trainer, because if a trainer rides that horse every day, they will catch a gait abnormality before we as veterinarian can see it. So in this case that you just mentioned is an amazing amazing idea where the trainer and the veterinarian work together to then fine tune and prevent future issues. That is definitely an amazing concept that we're gonna adopt from you.
Yeah, well, it's something that we spend a lot of time listening, and I am to that. When we talk joint injections, I often have folks say, well, Brandon, you must be anti-steroid. And corticosteroids, I am not, from the standpoint of a tool in the tool bag. If we're dealing with acute issues, corticosteroids are the greatest thing on the planet. But when we're dealing with chronic issues and long-term preservation of of uh, of those working components in that animal, regenerative products have definitely have a place in this world in terms of treating the mechanical aspect and improving the working function of that tissue.
There's no question about it that one, the corticosteroids do cause certain degree of joint damage, whether it's a little bit or a lot. We can obviously debate on that. Um, and like you say at the beginning of our conversation, there is a potential catastrophic effect sometimes, even if
Yes.
it's not common. You went through that,
Yes.
so it is a potential. Have you? And just so you've done 15,000 joints, and guessing 20 plus thousand ligaments, etc. Any catastrophic effect, or any horse that have had the same effect that the corticosteroids of your family earlier on had?
We have not seen it.
No side
The
effects.
From a safety perspective, um, about 2.6% of our cases may see some injection point swelling or some soreness. Most of the time, that's because we went too deep into the structure with the product. We try to keep it just sub-Q around the structure that we're treating. That The only side effect that we've got of the product is that sometimes it will go chase a more prolific inflammatory signaling somewhere else in the body. And if it does, we don't see the results we're looking for. And so it's not that the product didn't work, Dr. Rullan. It's just that it didn't work on what we wanted it
Yeah.
to. And in those cases, we retreat for free on our dime
Oh,
in
great.
which to help kind of skirt that. And second treatments, we pretty much nail them most of the time.
All right. Very good. So a little swelling. You mentioned on the side effect, this swelling goes away or stays forever.
72 hours.
72 hours. Ah, that's excellent. All right. So now we've talked about using Amnion Anicel for joints, for tendons and ligaments. We talk about wounds. We're missing two relatively new uses that we talk about. Let's do eyes.
Yeah. Yeah. So amnion as a history, we've been using it on humans for about 4 centuries. Okay. I mean, we can trace it back to 19 or 1600s as far as using it. And always the issue was, yo, lady, have your baby. This guy's dying over here. And so in 1910, we had 555 person study with the products. And then in the 40s and 50s, they started using it on ulcers, corneal ulcers in humans. And so we adopted that based on a lot of the current data, a lot of the things that Dr. Brooks here in northern Florida here has used Amnion for a lot of years. But we created a product that was a dehydrated version, not a hydrated version that didn't have to be sutured to the eye, and has become a one and done treatment for corneal ulcers, descemetous seals, melting ulcers, for treating descemet membranes, iris prolapses. And so, for a variety of different eye issues, it gives the mobile veterinarian and someone who may not have access to a boarded ophthalmologist or somebody who's got some more extensive technologies to use in eyes, or the animal owner who just doesn't have the dollars in which to go that route. Eye issues typically are a three to $5,000 deal if you go the boarded ophthalmologist route, and we always recommend that's the best way to go. But if your owner does not have those capabilities, we've got a product that for to the end user, 300 to 400 bucks. They can treat an eye with a tarsorrhaphy, pulling the eyelid down
Hmm.
and closing that eye for a couple of days over the top of one of our amnion discs and get really good results in the 90 plus percentile.
That's awesome. And can you use it with the antibiotics as well? That the eye, like let's say a horse is treated, is being treated with antibiotics inside the eye, has the catheter that goes through the eye. Would that affect the efficacy of the product?
It doesn't affect the efficacy of the product. We try to catch them prior to even going that route. A
Mhm.
lot of our veterinarians don't, because the antimicrobial capabilities, don't even use them with antibiotics. They may do some systemic antibiotics with the animal, but short of that, they're placing that amniotic patch in the eye and letting it do its thing.
Awesome. 3 minutes. And one last thing, and one of my favorite and most passionate thing, lungs. So we treated at this at our Epic Center. We treated a lot of horses with bleeding disorders, or I don't want to say bleeding like they bleed out, like equine exercise induced pulmonary hemorrhage. We call it bleeders, which happens in race horses, in battle racers, in polo horses, etc. Tell me about the treatment for bleeders. I know. Can you talk about that? That's
Yeah,
still in the
yeah,
research.
yeah.
All right.
So, over the course of the last several years, we've spent a lot of time, and initially, the science we were doing was to use the product in a nebulized format. What that means is aerosoling the product and then having the animal breathe the product. And while it was effective, we weren't able to really address deep lung issues where a lot of our exercise induced pulmonary hemorrhage happens. A lot of our asthma issues happen and really play havoc with the lung tissue. So we started using the product in an IV format in which to treat these deep lung disorders and improve the health of the tissue and reduce the occurrence of scar tissue. So really, the two things that have blown my mind as literally a layperson in this business that I wound up being CEO of. The thing that's really blown my mind is the fact that we can remodel chronically damaged tissue and remodel it to a healthy state. So we can take scar tissue and improve the health of that scar tissue, improving form and function of the tissue itself. And in lung disorders, that's really what we're needing to address is the scar tissue from either an infection or genetic defect. There's a lot of reasons that horses have what we call EIPH, exercise-induced pulmonary hemorrhage. There's just a variety of things that can cause that. But at the end of the day, it's the scar tissue that weakens the functionality of those lungs, and Amnion will remodel that.
That also another facet. If our clients want to learn more about Anicel, where can they go?
Oh, a couple of different places. anicelbiotech.com or facebook.com/anicel is where we put a lot of the treatments that have been done and a lot of the product applications.
Well, I just, on behalf of me and my patients, I just want to thank you so much for giving us the opportunity to have such an amazing product, none related to steroids, which is the most common use of a lot of these problems, and bringing some new products out that are efficient and natural. And it's so good to have you, and so good to have you with us here and what you do for us and for our patients. Thank you very much, Brandon. You have done fantastic.
Well, thank you for your time. We appreciate it.
Thank you. And if you want to learn more about Anicel products, amnion therapy, please do not forget to visit albertorullan.com. That is www.albertorullan.com. Have a great day.